A simple, cheap diagnostic test for malaria has become one of the key weapons used to fight the disease here in Tanzania and other African countries.
So what we see here is a queue of parents with their children, and they're bringing them to our survey area, our survey tables. So what we're doing is a clinical prevalence survey of malaria.
She's taking the blood to the... After introduction to the patient, she's taking the blood.
Over the last 2 decades, a number of tests have been developed which can measure through an immunological reaction proteins that are produced by malaria parasites. And these can be shown on a simple test strip now. And they're highly accurate, and it's very fortunate that these tests have been developed at a time where malaria is declining and there's an increasing demand to accurately diagnose malaria.
This will benefit people because we'll be having the proper diagnosis for the problem they're having, and therefore they get proper treatment.
The result probably will show that there are some other causes of fever that is apart from malaria. So the attitude of the prescriber will probably change, not to think only of malaria. That means also that the patient will be properly diagnosed and properly treated. The other benefit to the community is that the community will be notified about the results of the study, that there are a number of causes of fever that is apart from malaria. So once they get sick, they have to go to seek to medical services in the hospital rather than buying medicine from the shops and try to treat themselves, which is expensive, and they may be taking medicine which are not proper for their illnesses.
The latest generation of rapid tests for malaria are highly accurate. They transport well, they store well, they have a shelf life of up to 2 years, and they can be used by the most basic staff in really quite remote conditions where there's no electricity.
And all from a kit that comes in a box ready to test hundreds of patients. Reporting from Moshi, Tanzania, I'm Peter Goodwin.